That's what we've really been concerned about, is connecting people to the coverage that gets them the care that they need to be able to live healthy, productive lives. To my immediate right is Ms. Dranda Whaley. She works for the Tennessee Primary Care Association. She is the Director of Outreach and Enrollment for them. Previously, she ran Health Assist Tennessee. How many folks are familiar with Health Assist? All right. And so she's been working in this area for decades, trying to connect people to affordable coverage or different assistance programs to help them get their health care needs met. Right now, Dranda is working with the Primary Care Association has 9 health insurance marketplace navigators, and they work with 70 certified application counselors that are working in 25 federally qualified health centers across the state. You have some information on your table about some of those different partners that she works with. To her right is Walter Davis. He is the new executive director for the Tennessee Healthcare Campaign, a fantastic organization, I must say. And they have been working, it's a grassroots organization, consumer advocacy organization that's been working for high quality access to affordable health care for 22 years now. And to his right is Kristen Ware. She works for the Tennessee Justice Center that's based here in Nashville. And they are a patient advocacy law firm, a public interest law firm that focuses on health care. And specifically, they have a lot of area of expertise around the TennCare and Cover Kids programs and healthcare access for children. But we'd also like to introduce you to them. So I'd like to ask you a couple of questions first so that we get a sense of how you interface with clients that may be uninsured or the folks that may need some of the services that we'll be talking about. So how many people here work with clients that lack health insurance, that are currently uninsured? All right, vast majority. All right, how many people here work with clients who are currently on TennCare or Cover Kids? All right, we've got some information about that as well. How many people have helped a client complete an application for the health insurance marketplace? Woohoo! All right. And how many have helped someone complete an application for TennCare? All right, complete an application for TennCare since January 1st of this year. All right, I heard it in the back. Whew. There are a lot of things that have changed with the TennCare enrollment process. We're also going to talk about that as well, because even though that's not directly because of the Affordable Care Act, there are a lot of changes that the state has undergone that are attached to many of the changes around healthcare reform and the new paths to coverage. So we'll talk a little bit about that. So I'm going to start off, the way we're going to structure this, I'm going to ask some questions to the panel, and then we're going to open it up for questions from the audience. I also want to introduce you to Nikki. Where's Nikki's over here? All right. Nikki Vivret also works for the Tennessee Primary Care Association. She formerly worked with the Tennessee Justice Center, and I've had the opportunity to work with her in a variety of different capacities working for healthcare access. But she is a health insurance marketplace navigator. She's on the front lines of this. She helps people each and every day complete the application process and enroll in the coverage for which they're eligible. She's going to be walking around with the microphone, but she is also going to chime in because she has a lot of expertise to help answer questions too. You've all been involved in outreach and enrollment in some form or fashion, and one of the things that we're learning as a network is that public education is one of the biggest pieces here. All right, Walter, if you could give us one sentence that's most important for people to know now, what would it be?
Know what you need when you go to enroll the papers, and have some familiarity with the insurance plans.
All right. And I'm going to ask Nikki, doing this every day, what is one thing that folks in this room need to know?
Well, good morning. I echo what everyone up here said, for people to know what they need when they go. I also want to add, a lot of you work with TennCare. The good news is TennCare enrollment will be year-long rolling, so you don't have to do that by March 31st, so let that be some comfort. But for those who are picking a plan in the marketplace, that is March 31st is the deadline. But TennCare will be beyond that. Okay? Good? Awesome.
So let's go ahead and open it up for questions from the audience. What questions do you have for the panelists up here? What are some of your burning questions right now that you're curious about to be able to help your folks, to screen them or help them get enrolled?
What about the kids that already have TennCare? Is that going to change?
So that it shouldn't is the sort of simple answer. Some of the eligibility income levels have bumped up a little bit. There have been some changes in terms of what income counts, which we have found for the most part are helping families as opposed to hurting families. For example, There's no longer an asset test, which is huge. So that means that like money in a savings account doesn't count against you.
The second part of the question was about parents who have TennCare as a secondary insurance. Is that going to change for them?
Their TennCare eligibility shouldn't change. What I don't, Nikki, you might.
Yeah, that is a little tricky right now because the only way to apply for TennCare right now is in the marketplace. There's a system being worked on where people will be able to apply apart from the marketplace, especially for non-Magi categories, and we won't get into that. But right now, it is a little difficult. If you have TennCare, you can't apply for insurance in the marketplace, and vice versa. You won't be eligible for TennCare if you already have insurance. So we're not really sure what to do with that right now. That would be a situation where you call Tennessee Health Connection. That would be a situation where you could call them. That's a good first place to start. You can also call a navigator, Tennessee Primary Care Association, and we can look more into it as well. It's not totally clear right now.
The one other thing I would add about TennCare that's important for you to know for clients that have existing TennCare is that re-verification, they put it off until April 1st during all of this ACA excitement, and they are planning to upgrade to a computer system called TEDS, which is their eligibility. It's a computerized eligibility system. TEDS is not ready yet, and so re-verification is not starting April 1st. Usually individuals on TennCare would go through annual re-verification process. That won't start April 1st. We've been told by the Bureau that we will have at least a month's notice before re-verification starts. What we don't know is if it's happening all at once, if it's happening in a sort of staggered way. We just don't know. But that's another important TennCare update.
Everybody knows? Okay. Oh. Oh, go ahead.
I have spoken recently with a social work director at a local nursing home who claims that they have submitted in helping the family 17 applications since January 1 into the healthcare system for long-term care assistance. They received one letter back saying they would have a phone interview on the 45th day, which is the last day that you can work with an application before it is either approved or denied. The other 16 applications have not even been logged into any kind of tracking system and cannot be located. What's the outlook for that?
How many folks know that January 1, TennCare changed their eligibility and application process? Okay, we were sort of operating on a different assumption. So to catch everybody up, TennCare changed the process. So when folks used to go to, for example, there were different entry points for different programs for TennCare, but by and large, a lot of people would go to DHS, the Department of Human Services, to apply for TennCare or complete an application there. That's no longer the case. As of January 1 of this year, there is a kiosk set up there where people can go in and apply through healthcare.gov, but there's no longer in-person assistance to sit down and walk someone through an application. So what ends up happening is that a lot of those folks are going to the navigators or the certified application counselors for help because they're helping people through the marketplace. And essentially what happened is the TEDS eligibility system wasn't up and running and ready in time. And so folks are having to go through the marketplace for most of the traditional income-based categories. For some of the other categories like long-term care choices, some of the other savings programs or things that are dependent on a physical maybe Kristen can chime in on some of the other categories, but pregnancy, breast and cervical cancer, some of the other categories are handled through this new office, a new entity under the Bureau of TennCare called Tennessee Health Connection. Well, their processes are not totally streamlined, and I'm not sure that any of us are really clear on exactly what is happening behind the scenes for them to process those applications. And so that's part of the challenge right now. That's actually separate from the marketplace, but those things are compounding on top of each other, and of course clients don't know. They just know they need health care right now.
To the extent you have clients that are whose health is in jeopardy and they are at risk of being discharged, you can contact the Tennessee Justice Center. As you might imagine, with all of this, things are a little bit crazy, but we are trying to triage and to make sure that people who whose health is in jeopardy are getting the care that they need. So to the extent, and our number is 615 255 0331.
Kristen, would they also be able to, for the long-term care part of choices, contact the area agency on aging and disability instead of the marketplace?
Yeah, I mean, what we have been told about the application process, but it sounds like it sounds like your clients are already sort of far along on that, but that the path that should work is that they reach out to the AAA&D and submit their application through that agency. Where it goes from there and how it can be appealed, we don't know the answers yet in terms of if the eligibility stalls or if there's a denial.
I work for the Department of Human Services, and I'm actually a certified application counselor. They have just put 2 of us in each office. I went through the training last week. We've just been certified. Our secretaries previous to that had been trained to help people navigate through, not as in-depth as the counselors have been. But since the Medicaid had been moved and the TennCare had been moved from our office, they came in and, we did some computer training. And I just noticed on here that we weren't listed as a place, that could be of assistance, but.
We didn't know that.
Yeah.
So there are 2 CACs in every DHS office now?
Yes. Yes.
All right, that would have been good to know. Woo!
Right. Yeah. Yeah, the metropolitan cities will have more counselors. And then, but we are available to assist, and that's in every county, so that's a little bit more convenient for your clients. So.
Absolutely. That's transformative. That's really important.
That is such good news.
That is probably the most important announcement.
Yeah.
That's right.
In the last month.
Tennessee Health Connection.
Can you read it a second time, please?
It's 855-259-0701. And they're open more than just 5 days a week. I think they're even open on Saturdays.
I think so, too.
So
It's 6 or 7 days a week.
I think so. I think you're correct.
And they're trying to do, I think it was 7 to 7 even. So Tennessee Health Connection is where you should call if you have clients that are going through the TennCare application process and are unsure what's the status of their application, or if you need assistance with a TennCare application.
If a client has applied for the insurance and calling the 1-800 number, the 833 number, or the 855 number, and they tell them that they might be eligible for TennCare. Now, if they do not receive any data information back from an individual, will they be penalized after the 31st?
Vicki, you want to get that one? Sure.
So what you're saying is the marketplace will determine eligibility. For the time being, the marketplace is doing that. So when the marketplace says someone's eligible for TennCare, they are in fact eligible for TennCare until they hear otherwise. So what happens when they are determined eligible for TennCare is that information is sent to the state TennCare office. It takes a little bit of time to process that application, but eventually TennCare will send that consumer, that enrollee, card and information. They'll be assigned to an MCO that will be on the card. Then they can use those services. Like we said, TennCare is rolling year-round, so they will not be penalized for not having coverage after March 31st. If they are later found not eligible for TennCare, that will be a qualifying event. They can go back into the marketplace under a special enrollment period.
If the response from the marketplace is that you may be, you should probably go to the DHS office and talk to the certified application counselor there, because maybe is not a qualifier.
And sometimes it says it needs more information too. So if it says if you need to give more information, make sure they give more information. They'll have to submit that to the marketplace. Okay. And that's a great idea, Walter. Now that that's wonderful.
Yeah. And I did hear back from TennCare yesterday. Folks, if they are deemed eligible, should be hearing back from TennCare in 30 days after their application comes. So that's really helpful that we have a time frame at least. If they have questions, though, if the marketplace tells them you should be eligible for TennCare, we're sending your file to TennCare, the next step to inquire about it would be to call Tennessee Health Connection.
The other thing about that is that if someone applied and is eligible for TennCare, their effective date will be the date that they applied. Where on the marketplace, when you apply, your date is is later on, but with TennCare, it's the date that you applied.
If you have a TennCare application that you submitted in November or December and haven't heard from, they're telling us that they'll only go retro back to January 1 for TennCare applications.
We probably should have done a disclaimer at the beginning of this. Through all of this process, I'll tell you, there are things that we're figuring out together. Some things do not have right answers yet, which is a really frustrating place to be when everything's changing, right? But we may not have all of the answers. Sometimes there isn't an answer, or sometimes we learn something today that we didn't know yesterday. So thank you for your patience, and we're giving you as much as we know. So.
The thing about the TennCare application before the November, I work with the Choices program. I do the intake and coordination with applying for the TennCare for them. If they have applied before the November, before the January change, we've had a lot of our November, December ones that they weren't processing because we didn't use the new tools. We went back and reapplied them with the new tools, and it processed. It's still taking the 30 to 45 days for the DHS TennCare part to get their financials coverage, but I can say if you're doing a PAE on a client for that's just trying to get them medically cleared, they're kicking them out in about 2 days, 2 to 3 days. So they're really on top of that right now. So we really need to give them some credit. But the DHS part, yeah, they're still trying to get all the kinks and stuff out. So it is 30 to 45 days.
That's good to hear. Okay.
It sounds like to me that we could use a big conference call between the TennCare office, outreach people, and Choices, and hear some of the same information at the same time. Because that's what we do, is we share information like that. It would be nice to have that involving the state.
All right. Well, I think we can do one more question, then we're going to need to wrap it up here.
Who's it gonna be?
All right. Everybody know everything they need to know? All right.
There's been a question.
Oh, we've got some up here, Nikki.
Just fast forward for a couple of weeks to tell us what life will be after the deadline.
Ooh.
As far as when are you going to kick back up for the next year, and also what happens when people do perhaps find themselves with a qualifying condition that would, or qualifying events in that category.
That's a perfect ending question. Thank you.
And I can talk about that. The guidance that we have received from CMS and from HRSA is that there is still going to be plenty of work to be done. Folks could qualify for to apply for the marketplace coverage if they have a qualifying event, such as if at the time that, before March 31st, if after March 31st they have a divorce or they change jobs or a qualifying event that would make them now eligible for the marketplace, they can go to the marketplace and report that, and then they can apply for coverage. TennCare, like we said before, TennCare Cover Kids enrollment is year-round, and I have to say I'm so happy to know that we're going to have help from the DHS offices. Those of you who work at DHS offices, we have missed you so much. So I'm really, really thrilled to hear that you all are going to be able to help with the TennCare and Cover Kids enrollment. The other things that we'll be doing will be helping people know how to use their health insurance. That's a huge thing. Getting people enrolled is one thing, but people need to know what that means now. They have to pay their premium every month. They need to make sure that the doctors that they're trying to see are in their network. They need to take advantage of those preventative care services that are available for free. So there's going to be a lot of work that folks in the clinics and folks who are navigators and others will be helping people know how to use their health insurance. And then, yes, we will be gearing up for the next open enrollment period, which starts November 15th.
The next open enrollment period goes from November 15th through February 15th of 2015. So November 15th of this year through February 15th of next year. And please join me in a round of applause thanking our panel for coming this morning. They are a busy bunch this week, as you might imagine. Thanks. Have a great conference.